joining us for this Jackson Health System update on Omicron. I'm going to go ahead and introduce the panel. With us this afternoon, Dr. Peter Paige, Executive Vice President, Chief Physician Executive, and Chief Clinical Officer at Jackson Health System. Dr. Lilian Abbo, Associate Chief Medical Officer for Infectious Disease and Antimicrobial Stewardship at Jackson Health System. And Dr. David Andrews, U-Health Pathologist and Medical Director of the Pathology Laboratory at Jackson Memorial Hospital. So we'll leave the questions for the end. Please use the Q&A feature as well as the raise the hand tool. Dr. Paige, if you want to get started and give us an update and an overview of what you're seeing.
Sure, thanks, Tanya, and good afternoon, and thank you all for joining us. I want to start off with a little update of the current state as it relates to COVID in Miami-Dade County. Currently, we are seeing an increase in COVID cases, which everyone is probably aware of. We track two key metrics at the county level, really to give us an idea of where we are day to day and week to week. They are the 7-day new case positivity rate and 7-day new cases per 100,000. They're metrics that are commonly used to categorize us as it relates to community transmission risk and really is the spread of the virus across different parts of the community. When we look at these two numbers, especially over the past 3 or 4 days, we're seeing dramatic increases in both. And again, suggesting that this virus is starting to spread again very rapidly and involve different members of our communities. In this same line, we have identified Omicron variant in Miami-Dade County. And as Dr. Andrews is going to allude to in a little bit, we have seen a significantly increasing prevalence of Omicron among these positive cases that we're identifying. On the positive side, it appears that a lot of the people that are testing positive are either asymptomatic or showing mild symptoms. There are some, obviously, that are sicker, but those numbers are a little bit smaller. I think the other important factor, this variant, this Omicron variant, has been shown to be 2 to 4 times more transmissible than the Delta variant. That's a really important factor as it relates to community transmission risk, and one that we have to remember. And they've talked about doubling rates of every 2 to 3 to 4 days, which again is very aggressive for this variant. I think as we look at hospitalizations, we've seen those starting to trend up as well, just not as aggressively as the new case positivity rate or the new cases per 100,000. And we are seeing a significant number of the hospitalizations that are testing positive for COVID, but more coincidentally than related to a primary COVID complaint. Those would be people that are admitted for a different reason, getting screen tested as they get admitted and then testing positive. We continue to obviously promote vaccinations. What we're seeing is that the vaccination program, especially with boosters, with this variant, have been shown to be at least significantly effective in decreasing the risk of severe disease, hospitalizations, and death. So, we want to continue to promote that. And if you haven't been vaccinated, get vaccinated. If you're eligible for a booster, get a booster. We continue to encourage mask wearing, especially in high-risk situations, indoors, crowded venues, poor ventilation. Try to get outdoors. If you're going to gather with people, try to decrease the risk by getting out of the indoor spaces. And the other thing we're really trying to promote is that if you do have a significant exposure, or if you're symptomatic, with some of the classic symptoms you've heard about with COVID, get tested. And then if positive, follow the appropriate isolation and quarantine protocols. We are seeing testing across the county increase significantly. So we're encouraged by the fact that people are seeking out tests and test sites. We're also seeing an increasing use of monoclonal antibody therapy, which again is suggestive that more and more people are testing positive and seeking therapy. So with that, I'm going to turn it back over to you, Tanya.
Thank you, Dr. Paige. Dr. Abbo, for our Spanish media outlets, can you please give us a summary of what Dr. Paige said?
Sure. Buenas tardes a todos. Lo que estamos viendo en estos momentos es, como explicó el Dr. Paige, un aumento de la transmisión de coronavirus en el condado de Miami-Dade. Esto se debe, en parte, a el aumento de casos de Omicron. ¿Qué está ocurriendo? Omicron es una cepa altamente transmisible y altamente contagiosa. Aún no sabemos si va a ser mucho más severa que otras cepas. Estamos viendo un aumento leve en casos de hospitalización, pero sí hemos visto un aumento significativo en el número de casos positivos, tanto a nivel de las emergencias, centros de urgencia, como a nivel del condado. También tenemos más personas presentándose con síntomas leves o recurriendo a los centros para recibir anticuerpos monoclonales. Todo esto es indicación de que la gente tiene síntomas y hay mucho más contagio. Esta cepa se disemina de 2 a 3 días. Es un periodo de incubación más corto y es altamente transmisible, 3 a 4 veces más transmisible que la cepa Delta. Entonces, ya para el momento que usted tiene síntomas, usted ya contagió a muchas personas. ¿Cuáles son las medidas que se deben tomar en estos momentos? En primer lugar, no hay razón para entrar en estado de pánico, pero sí hay que tomar acción y no es el momento de pensar que la pandemia se acabó. Hay que seguir utilizando máscaras y sobre todo cuando se encuentran en áreas cerradas. Es sumamente importante utilizar las máscaras para protegerse del contagio. 2. Si usted es elegible, por favor vacúnese. Y si es elegible para el booster y tiene más de 6 meses de vacunado, colóquese un booster. Esa es la mayor prevención, máscaras y vacunas para prevenir una enfermedad severa o muerte. Sumamente importante. Tercero, el lavado de manos y el evitar lo que llamamos big crowds y estar con mucha gente en un sitio, sobre todo sin máscaras a puertas cerradas. Todas esas son medidas que todo el mundo puede tomar y por favor escuchen, sabemos que todos estamos cansados de la pandemia, pero esta cepa se está diseminando rápidamente y tiene una alta probabilidad de contagio, con lo cual nos puede arruinar a muchos las vacaciones y las fiestas. Gracias, Tania.
Thank you, Dr. Abbo. Dr. Andrews, I know that you wanted to share a few words, so whenever you can.
Thank you very much, Tanya and Dr. Abbo and Dr. Paige. I just wanted to bring folks up to date of where we stand with our variant tracking. We've been tracking the variants during this pandemic since the very beginning, and we've seen waves, the Alpha wave, and more recently the Delta wave. And I can confirm now that what we are seeing is a rapid emergence of the Omicron variant. In our last sampling of random patient samples from UHealth and Jackson Health, representing a broad swath of the county just randomly because of the distribution of both health systems throughout the county, we're at over 80% positive for Omicron variant by a combination of straightforward PCR methods and sequencing. So this is really unprecedented. Our first case was described. We saw our first case of Omicron on a sample obtained on December 2nd. In a period of about 2 weeks now, we are really rapidly emerging. I would say a total replacement of the Delta variant, which is the preceding variant that was present at 99%. Rapidly, Omicron is replacing Delta. At this moment, over 80% of samples are testing for the Omicron variant.
Dr. Abbo, can you please translate in Spanish what Dr. Andrews just said?
Cómo no, Tania. Voy a tratar de simplificarlo en la mayor medida posible para que nuestra audiencia en español pueda entender. El Dr. Andrews y todo su equipo de laboratorio ha estado haciendo un trabajo magnífico y desde el comienzo de la pandemia han estado realizando secuencia genómica epidemiológica para tratar de identificar nuevas variantes. Hemos visto la ola de la variante alfa, la ola que tuvimos en el verano de la variante delta, y en estos momentos estamos viendo una ola expansiva sumamente rápida de Omicron. El primer caso fue detectado el 2 de diciembre y del 2 de diciembre hasta ahora, en cuestión de 15 días, hemos visto que ya el 80% de las muestras en secuencia genómica y en PCR están demostrando ser Omicron. Esto quiere decir que esta es una cepa mucho más contagiosa de lo que hemos visto con cepas anteriores.
Muchas gracias. Una de las preguntas que llegó de Arlie Alfaro dice, ¿cuántos casos de Omicron? Pero no, ¿cuántos casos en el hospital o en el condado? Es lo que no puso. ¿Tenemos esa información?
Todavía no tenemos eso. We don't know yet the specific number. This is all happening very rapidly and we do need to embark on a more structured analysis and surveillance at the county level. What I have reported for Omicron variant reflects samples that we're retrieving from our laboratories where patients have tested positive. We do need to engage a more structured surveillance program with the county to get a more precise number of cases.
Yeah, and we're sampling less than 10% of the positives. So, no podemos decir en estos momentos de la población, si tenemos 1,000 personas que han salido positivas, no sabemos cuántos exactamente son Omicron. Lo que sí sabemos es que de esa muestra, de ese 10% que hemos hecho, 80% parecieran ser Omicron, cuando hace 2 semanas eran menos del 5% y hace un mes no había Omicron. Entonces, el mensaje es que rápidamente Omicron se está regando. Si son 1,000 personas o 1,500 en estos momentos no hace diferencia. Lo importante es que el CDC ha venido haciendo secuencia de 30 a 40,000 muestras diarias. En las muestras del CDC ellos estiman que más o menos el 3% es Omicron, mientras que en otras partes del país está una mezcla entre Omicron y Delta. Ellos calculan que para finales de enero Omicron va a ser la cepa prevalente en todos los Estados Unidos. En Miami estamos viendo algo diferente. En Miami estamos viendo que esta cepa se está regando mucho más rápido y en parte puede ser por nuestras conductas, el uso de máscara y los viajes, etc. Entonces es importante entender que no todo lo que se ve, eso en enero, no, eso ya está llegando aquí y queremos tomar las medidas en estos momentos para proteger a la población.
The next question that came up is from News Radio 610 WIOD. How effective are the vaccines against the Omicron variant?
Would you like me to answer, or Dr. Paige wants to answer that one?
Oh, you can answer this one,
Okay.
Dr. Abbo.
So what we know so far is that the vaccines, especially the boosters, are more effective, over 80% effective in protecting against death and severe disease. None of the vaccines are going to prevent 100% infection. So even if you're a booster and vaccinated, you may still get infected, but the idea is to prevent serious infections and death and cut the chain of transmission. What we do know is that the vaccines that we have available are 20% less effective against Delta and around 30% less effective against Omicron. If you already had COVID, if you already had infection, getting vaccinated protects you. You become like a superhuman. Your antibodies, your neutralization of antibodies is much higher if you're vaccinated in addition to having infection. So I would encourage people who say, no, I already had COVID a year ago, please get vaccinated because that will really protect you from severe disease, and that's very well proven scientifically.
Dr. Abbo, for that question, do you mind saying it in Spanish as well?
Por supuesto. La efectividad de las vacunas en estos momentos sabemos que no es del 100%, porque ninguna vacuna va a prevenir al 100% infección. Pero las vacunas están protegiendo un 80 a un 70% contra enfermedad severa y muerte. Por eso es tan importante el énfasis en vacunarse y en ponerse el booster, incluyendo personas que ya tuvieron infección de COVID, que dicen, yo no me quiero vacunar porque ya me dio la infección. Tenemos data científica de que cuando estas personas ya infectadas, que tienen anticuerpos naturales, además se colocan la vacuna, tienen lo que llamamos, se vuelven superhumanos, tienen una mayor protección contra el virus y mayor neutralización de anticuerpos. Entonces, es importante que la gente entienda que las vacunas siguen teniendo efectividad para prevenir una enfermedad severa y muerte, y sobre todo la importancia del booster, porque después de 6 meses los anticuerpos han ido decayendo. Esto es sumamente importante en las personas mayores, personas en ancianatos, personas en diálisis, trasplante, cualquier persona inmunocomprometida, hipertensos, obesos, diabéticos. Sumamente importante vacunarse y ponerse ese booster. Y el resto de la población igualmente, vacúnese y póngase la máscara.
Gracias, Doctora Abbo. This question is from Francis Wang. We know it is more transmissible, but symptoms showing are more mild compared to other variants. So will this, in a way, make us more closer to herd immunity?
You know, I'll start off, and if either Dr. Abbo or Dr. Andrews wants to follow up, that'd be great. It's still early, and we're trying to make everybody aware that this is still a very early emergence of this Omicron variant. We're seeing milder presentations currently, and that's some of the history that we're getting from other parts of the world. We still don't know how progressive this variant is going to be as it relates to severity of disease. So I caution everyone to, look at this as just being a mild infection and not have the potential of being something more significant, especially in those populations that are most vulnerable. And that being said, we think that probably every infection, every vaccination, every booster, is going to hopefully continue to get us closer and closer. It's just that, we're still, battling a new variant now. We don't know what's around the corner. So it's very difficult for us to jump to the conclusion that we're getting too close to herd immunity when there's still so much unknown. So we're approaching it with cautious optimism, and we'll see what lies ahead.
Dr. Andrews, did you want to say something? You have to unmute yourself.
Yes, I'd like to endorse that. The thing that's different about Omicron, and it's applicable to all of the different variants, Omicron has many, many mutations that make the spike protein, that's the protein that our vaccinations are directed towards, makes it quite different from the vaccinations. And so I think that's the challenge, is to understand, is first of all, vaccinations will help because there are still many, many common elements. But I do think that it's important for people to get vaccinated, to get boosters now, if they're eligible, not to delay them, because the closer you are to a vaccination event, the more protected you will be. And I think also this concept of herd immunity that we've discussed a lot over the last year or more than a year is starting to be something that is not going to be easily achievable. I think it's going to be it's a very difficult target to achieve. Herd immunity has an underlying part of herd immunity is the thought that people are all exposed to the same infectious agent. Now, the variants change the gene. They shift the nature of that particular virus. In particular, an infectious agent that is extremely transmissible, like Omicron, makes herd immunity even more important. So it just all leads to the messaging that vaccination is the most important tool that we have available to us to decrease transmission and to put this behind us.
Dr. Abbo, did you want to share a few words?
In English or Spanish?
In Spanish, whichever, it's okay.
Bueno, la pregunta es si creemos que vamos a alcanzar la inmunidad de rebaño, y tanto el Dr. Paige como el Dr. Andrews han explicado. Esto es un concepto que va a ser muy difícil de explorar y de explicar en estos momentos. El virus ha ido mutando muy rápidamente. Este virus tiene muchas mutaciones que inclusive pueden evadir parte del sistema inmune. Tenemos personas que se han infectado con Delta que se están infectando ahorita con Omicron. Entonces no existe esa inmunidad de rebaño porque tú pensabas que por haber tenido Delta no te va a dar otra vez COVID y ya esta es la segunda y la tercera vez que a ciertas personas que no se han vacunado les ha dado COVID. Creo que el concepto más importante que tiene que entender la población y la prensa en estos momentos es que hay medidas de protección. No podemos hablar de inmunidad de rebaño natural, vamos a infectarnos todos para que esto se acabe más rápido. Ese es el mensaje equivocado. En estos momentos tenemos que protegernos, tenemos que usar vacunas, tenemos que usar máscaras. Y sí, el distanciamiento social, porque todos queremos seguir con nuestras vidas, queremos seguir con la economía abierta y no queremos que haya más cierres, queremos seguir con nuestras vidas, pero tenemos que hacer nuestra parte y la vacunación es una parte sumamente importante. No podemos solamente contar con una inmunidad natural, no es lo más seguro y no es lo correcto en estos momentos.
Muchísimas gracias, Dr. Abbo. Are there any other questions from the media that are present? You can use the raise a hand tool or you can write it in the Q&A. Okay. I don't think there are any other questions. I want to thank Dr. Andrews, Dr. Abbo, and Dr. Paige for being on this call and for the media that attended. If you have any other questions, you feel free to follow up with the media relations team of Jackson Health System. And we thank you all for being present with us this afternoon. Thank you.